Dr. Salunke, I was asking you what really you think about this particular step that has been taken by Maharashtra government.
No, the point is, at this juncture, Maharashtra government, according to the discussion that I had with the Honorable Health Minister, is not proposing to get away or get rid of the mass use in immediate future, tomorrow, day after tomorrow. That's not the plan. It appears as the pandemic is definitely on the downward trend, and it is also clear that the possibility of unless please note this particular, unless there is going to be a new variant coming up, which is a threat which is described by WHO. If that doesn't happen, and if it is not virulent, the potential of this pandemic turning into an endemic situation in next few months is quite bright. So under the circumstances, the maximum possible relaxation depending upon the situation of the pandemic is being considered. And in that, wherever there is a possibility of transmission, like say, the people coming in an enclosed space or say less ventilated area, certainly masks are going to be obligatory and it must continue. But also please note, one thing is absolutely clear, that we are still in a position not to consider ourselves as safe because our vaccination percentage, including our own state and our own country with 2 complete doses, is not beyond 55-60%, which is much lower than what the anticipation is or what should be the properly done. And when we compare with UK, I mean UK is a different ballgame altogether. They have a different geography, topography, socio-demographic profiles. Everything is different. Why should we compare ourselves with UK? I'm not very keen to copy what is being done in Europe or UK or USA. No, we should look at the epidemiological situation in our own country, the kind of population that we have. There are a lot of challenges that we are facing. Our health infrastructure, please try and understand. Suddenly, if there is going to be, newer variant coming up with the acute sort of virulence, we will be in very serious trouble. So, is our health infrastructure prepared for that? The
in
answer
fact, yes,
is that.
yes. Dr. Salunke, I completely agree that US and UK and other Western countries like that can't be the ultimate parameter when it comes to our own COVID rules, our own COVID strategy. But then question arises, what should be the parameter when it comes to review the COVID rules which are in place? Given right now that we are looking at the current COVID situation, but it is very, very dynamic and also very unpredictable in nature. Should rules be reviewed at something, say, more solid like vaccination coverage, in your opinion?
According to me, there are 2-3 most critical criteria. One is vaccination coverage, as you rightly said. But before that, I'm being insisting at the central level also that did we build up the capacity to do early warning signals through the surveillance, including genomic surveillance? Do we have the laboratories on a sustained basis? It is not only for this month or this year, on a long-term basis that we are in position to catch up the emergence of virulent or non-virulent newer viruses which may be becoming potential public health threats. So that capacity needs to be built up and that needs to be monitored. Vaccination needs to be monitored, and most importantly, right now on a short-term basis, how many people are getting admitted in ICU and what is the case fatality and total number of deaths. Now, these are 3 or 4 areas which will be short-term, medium-term, and long-term. We will have to monitor that. Use of masks is just, it has its own value. Say in some countries, even though we may not compare with other countries, but in Japan, was being used even prior to the pandemic. And if we use this mask to protect ourselves from respiratory infections and other sorts of problems, why not? If you have picked up an habit and if you are comfortable to use masks, I will be using it when I'm going to be in the aircraft, irrespective whether this pandemic turns into an endemic or not. I will certainly use it, and I will encourage people that do use it when you are in aircraft, when you are in bus, wherever there is congregation. and particularly very ill-ventilated areas, do use masks if you are comfortable. So masks need not be considered as we should get rid of it as ASAP. No, masks should become a part of our life if you are comfortable. But compulsion, forcing people, finding them, those are the things that can be deleted. No problem.
Yeah, that is a very important point that you are raising, Dr. Salunke. When it comes to lifting COVID curbs, don't you think that mask mandate should be something which should be looked at last? Because there is no big economic cost involved. There are no apparent physical discomforts, as you were also mentioning. If anything, it is a really, really effective tool to keep the virus at bay.
Certainly. And as I explained to you, the use of mask has other utilities also. See, we have seen even in children, whenever those who can use the mask, the possibilities of the respiratory infections are definitely reduced or they come down. So mask is a good tool. If you can use it, do use it. As you rightly said, we needn't bother about the mask and its legalization or non-legalization. There are many other issues that we need to address, particularly the kind of health infrastructure that we have, public health infrastructure that we have. We should feel very unhappy that in a country like India, what kind of public health infrastructure that we have created in last 70 years. I'm not proud of that. Neither government of India nor state government have put in adequate resources nor given the priority. Even as of now, do you think government of India is giving the priority and sustaining the public health as a priority issue? What kind of budgetary provisions are being made? How are we going to, whatever last year's budget that was given to public health, how much it has been utilized? How many, additional manpower, skilled manpower has come up? How many hospitals have come up? What kind of laboratory capacities, particularly viral and public health laboratory capacity, we are planning to increase? On paper, it may be there, but in reality, public health infrastructure of this country is far from satisfactory. Many people don't like my comment, but do we have adequate resources of human resource that we have? Do we have public health people at the block level? No, we don't have it. So things that can be done easily are not being done. That need to be done. And that mask will be definitely a useful tool for in the near future, and then eventually let it be left to the public health people, individuals to decide on that rather than putting that in the form of rules and regulations. Yes, it's used as a mandate, must be part of the regulation, but to use or not to use, leave it to the individuals as and when it becomes a non-public health issue, or the pandemic becomes a non-public health priority.
So, Dr. Salunke, just to summarize the entire conversation, before I let you go, one word answer I would need from you. If at this point in time, Maharashtra government asks for your opinion and asks you that should mask rule at this point in time end or not in the state of Maharashtra, what would you say?
Certainly, I will say that please let's not hurry on this issue. Let us take into consideration the evolving epidemiological situation. Let us also take into account the inputs from the public health persons, epidemiologists, clinicians, and the virologists, and then accordingly let us plan. And this is one sort of an intervention which has no side effects, no negative effects. People are not dying because they are using masks. So let them use it. Now, what's so great about it?
That's right. Dr. Subhash Salunke, thank you so much for speaking to us. And there you heard an expert giving his opinion on this particular development where Maharashtra government is mulling to end the mask mandate. He's clearly saying that there is no need to rush into things and let's keep all the factors in mind while easing out the COVID curbs which are in place.